Enjoy the ride with Crystal Petry, consulting, so inspiring.
Hello, and welcome to another episode of 60 Minutes With. I'm your host, Crystal Petry. On today's episode, we are going to talk about a rift, mistrust, no rapport, whatever word or phrase you want to use, between the Black community and the medical profession. Why is there no trust between these two entities? We'll learn about that, but we'll also learn what can be done to build that trust again. And here to educate us on all those things, Miss Ingrid Holmes.
Hi, how are you?
I am good. How are you?
Wonderful, wonderful. Thank you for having me.
Thank you so much for agreeing to be on the podcast and talk about what might be a decisive subject, do you think?
I don't know that. It's about educating.
Yes.
I don't think it's divisive. I think it's about educating. And hopefully that's what people will take away from the podcast.
Exactly. And that's what I want people to take away. You know, we're not trying to stir the pot here.
At all.
We are just trying to educate for both parties, for the Black community and the medical profession.
Absolutely. Absolutely.
So my first question, you were health director of the city of Beaumont for 30 years.
Yes.
So you have experience and expertise on this subject that we are getting ready to discuss. How did you become the health director of the city of Beaumont, Texas?
I have always had an interest in healthcare. Since I was 16, I
Okay.
started working in a doctor's office, and I've been in healthcare ever since. But specifically with the health department, I was working in the lab at the health department when I was in college, when I was in undergrad school.
Okay.
And when I completed my degree, there was a position open for a health educator. So I became the health educator for the city of Beaumont.
Mm-hmm.
After that, I stayed there for about 2-3 years.
Okay.
And I took a job as the executive assistant to the city manager. I was there about 9 months, and the health director resigned. And my boss said, I need somebody out there who can help to just kind of keep things together until I find a health director.
Right.
Well, guess what? I never left.
What?
I stayed.
Yes.
And so that's really how I was the administrator, because we did have a full-time physician. And then when the physician left, they saw where being a non-physician worked at the health department. So I stayed.
And would you say, your love of health? Where does that stem from?
I think it stems from education.
Okay.
I think it stems from educating people about changing their life and doing things better with their life. I like studying. I like statistics. I like numbers.
Okay.
I like seeing changes. So all of those things.
Okay, well that position was perfect for you.
It was perfect for me. That's why I stayed
Yes.
30 years.
What would you say is your most prized accomplishment as the health director?
I think I saw a shift in what public health started out as and what it became when I left. I saw with the help of an amazing team, I saw how you could take different perspectives of health. You know, when we think about health, we think about your physical health.
Right.
But there's environmental health, which impacts your physical health. There are emergency services. There are public health planning things that are important. You know, in Beaumont, when we evacuated all those people for the hurricane, it was a collaborative effort. So being able to work with other departments, to work with the state, and to work with actually then nationally, those were some great accomplishments. And I didn't do it alone. I did it with some amazing staff.
Does the health department work with all of those things? The environmental health, the emergency? Really?
Yes, yes. I at this time, environmental health is, of course, still a part of the health department. When I was there, even code enforcement was a part of public health. And what makes that important and what ties all that together, because you have different health professionals and different environmental professionals working together as a team to accomplish a goal.
Right.
So if someone is living in poor conditions, we don't want to just go in and clean it up and say, okay, that's it. We do that, but we come in with information on what you can do differently. There's a reason that people live like that. So we tie them to different resources. And not every profession may have the understanding of what those resources may be.
Okay. Now, I don't know if it's possible, because you were there for 30 years at the health department in Beaumont, Texas, but is there anything that you wanted to accomplish that you did not accomplish?
That's a good question. I think what we accomplished from where the health department began to where it was to where it is was significant. I would say I would have liked to have expanded maybe educational outreach specifically to African American women.
Okay.
That was very personal to me, though, so I don't know that that would have been a task that I would have done in public health, or if it was a task that I am still charged to do now.
Yes, yes. You have worked in healthcare since you were 16, which is like yesterday.
Right.
So you have seen and probably felt the effects of the mistrust between the Black community and healthcare. Why is there that mistrust?
I think mistrust began years ago because of studies and things that came out that really were wrong, and they really did cause the Black community and other minorities to not trust the system.
Right.
We have seen in the last 20, 30 years even apologies for what's happened. And so people have begun to trust the system, because although we've always had physicians that were African Americans, you see now that we have more of them. And what we have now also are people who understand different cultures. And so I think when we say that there is a mistrust, I think it's people not understanding from both perspectives, the healthcare perspective and from the community perspective. So what we've seen a shift in that.
Do you think it's important and it helps with trust and rapport when, as a Black woman or a Black man, I can see a Black doctor or even a Black nurse coming into my room?
I think that helps. I think people see someone that looks like them, and they may feel comfortable sharing their eating habits. You know, they may feel comfortable talking about certain topics that they may not feel comfortable talking with other groups about. That may be a situation.
Let's talk about some of the events that have led to the mistrust and the breakdown between the Black community and healthcare. And I wanted to point this out because I want my viewers who are watching to be able to see that this is not just something that people in the Black community are making up or it's just in their head, but things have been documented that was wrong against the Black community. So the first thing I'd like for you to talk to us about is the famed hospital, Johns Hopkins Medical Hospital, stealing Henrietta Lacks cancer cells without her permission in 1951.
Okay, and see, that's the way you phrase that would scare me. Back then, there were not a lot of permission slips like we have to see now. You can't just take my blood and I not sign that you take my blood. Back then, we didn't see that. So in 1951, when she had tests done, she went into Johns Hopkins because she had a mass on her cervix. And, as you know, she died from cervical cancer. But that cell, the HeLa cell, actually became very important to healthcare in general in our community.
And still to this day.
To this day, because her cell was able to grow. Mm-hmm. Now, during that time, nobody ever shared with her that they were giving her cells away.
Correct.
And her family, of course, should have been compensated for that because it made a difference in history. But keep in mind, the doctor who did it did not make a dime from that. Correct. It wasn't until the pharmaceutical company or the medical company started to use that there was money to be made for that. So a lot of people don't even know about that study.
I know they don't.
And so it really goes back to, and if you read articles, it doesn't even talk about it. It goes back to HIPAA, my right to privacy with my health care. Mm-hmm. And so that wasn't a case in 1951.
It was not.
But today, it is. And so people can't take your blood and go just have it tested. They can't do all of that. Unless it's a public health issue, that's a whole nother story. But they can't just take it and do what they want with it without your permission. And so that was the challenge about what happened. So was it beneficial overall? Yes, it was. Should they have done that without her permission? Absolutely not. Absolutely not. Because she still had to go through the agonizing situation with having cervical cancer. But she went in for a test. And what they didn't tell, and she wasn't the only one, she just happened to be the one whose cells would continue to multiply.
Correct. And as you were talking with the Hele, which is the first two letters of her first name and last name, and that's what they named the cell, and that cell still has that her name with it. But you know what? I have studied her case, and I've watched the documentaries. Never once did I think about, and they didn't say the permission. They didn't have permission slips and HIPAA and things like that at that time. And it really changes the way I see that story. Like right now in this moment, I'm completely changed in how I see that story because there was no HIPAA. There was no permission slips and forms for her to fill out to give permission.
Right. They should not have done it.
No, they should not have
But
done
there
it.
was nothing at that. It was just wasn't an ethical thing to it.
Right. Thank you. Look, already educating me. Already educating me. Okay, so the next one I would like for you to speak to us about is the Tuskegee Experiment in 1932 through 1972.
That was when men who were already diagnosed with latent syphilis, they weren't given syphilis.
Correct.
They were already diagnosed with latent syphilis, and men who did not have it. There were 600 men, 399 were already diagnosed with latent syphilis, and the others did not. They wanted to see what the changes would be for that person if they didn't do anything about it. They told them that they were being treated for bad blood. Well, back then, bad blood could be a number of things. Syphilis was one of those things. Now, when they discovered penicillin, and this is where the real issue is, they didn't treat them then.
Exactly.
That's the problem. They didn't treat them, and they continued the study.
Correct. And these are all black men.
Sharecroppers.
Correct.
People who did not, who were not highly educated to understand. And even if they were, one of the things I find that level of education does not equal understanding of healthcare. Mm-hmm. So, it's just like level of education doesn't, if I don't know anything about accounting, then I don't care how educated I am in health, I don't know about accounting.
So they cannot be blamed for that.
Right. So nobody told them. And so they didn't treat them. And you'll know that there were apologies that went out. Their families received $10 million out of court settlement, the surviving members of their family. That was unethical. It was just absolutely unethical and should not have happened, and men died who didn't need to die.
Right. Absolutely, absolutely.
people, because then the women who were not a part of the study were affected because of the men that they were married to or involved with. And they never talk about that.
They never talk about. You know what? I am so glad that Sheree Reed referred you to this podcast, because I have never thought about that. Whenever I read, and I am a lover of history, and I'm an avid reader, so whenever I've read about this experiment and it's, the case study, I knew that the men already had syphilis. A lot of people think that the government gave them syphilis,
Absolutely.
and that is not
That is-
correct. They already had it, but they did not treat them once they discovered penicillin. But I never thought about the other people that are affected by it. The women that they are married to or dating, and they pass that disease on.
Yes.
So
And so
it-
when you talk about mistrust, see, sometimes the information is even, many times people thought they were given syphilis.
Exactly.
So, yes, I'm going to mistrust a government that gave somebody syphilis to see what happened.
Right.
That's not, they didn't give it to them.
They already had
But
it.
we create that thought of mistrust
Yes.
because it's not, the information is not
Yes.
accurate.
And I would suggest to my viewers, if this is your first time hearing about Henrietta Lacks or hearing about the Tuskegee Experiment, please go and do your research and look that up so that you can be educated about that. But a lot of people in the Black community thought that the government gave their own American citizens syphilis, and that was not the case at all. So I'm glad that we were able to educate some people on that. The next thing I want to talk about is Black women have the highest mortality rate in the United States. It's 69.9 per 100,000 live births, and that's as of 2021. Almost 3 times the rate for white women, and that's according to the Centers for Disease Control and Prevention. You are not a doctor, of course. But why do you think the mortality rate is so high in the Black community and not the same in other communities?
Well, I think the story that Serena Williams tells,
Yes.
and every article you'll read about it will tell you this too. It has nothing to do with socioeconomic status
At all.
And her story says that her doctor didn't listen. Well, not her doctor, but the initial medical providers didn't listen.
Mm-hmm.
She knew her body. She
Correct.
knew what it was saying, but they didn't listen. So we'll go back to, we have some pre-existing conditions.
Mm-hmm.
Many of us may have hypertension. There may be environmental issues, environmental stress that may impact us. We talk about women at a higher socioeconomic status that I'd like to say, those particular women are extremely stressed. They're trying to be successful. So their stress level is a different stress level.
Correct.
But it doesn't go away, and hypertension is related to that. And also related to poor outcomes, sometimes during pregnancy, if left untreated.
Correct. And just a quick recap, the Serena Williams story, she had just given birth to her first child, and her body, she could feel something was wrong, and she was telling the nurses and the medical people that were coming into her office, and they kept just blowing her off, and it turned out she had a blood clot. She had a blood clot, and they had to, I think, did they have to do surgery?
They did.
They had to do emergency surgery.
They did.
Luckily, because it could have killed her. But, I think
She had a history of blood clots.
Yes. And so as she's trying to tell them this, they kept don't worry, you
It's
just
not
had a
that.
baby. It's not that. They were not listening to her. And, just to bring it together, I feel like that's probably what happens a lot of times, that Black women are not listened to in the healthcare facility, in the field of healthcare.
Right. Sometimes there are just so many myths, you know, about how we react or what we do, or, you know, there's always something about, oh, you're so hyper, you know, you're just so involved. You'll be fine. Just calm down. I can't breathe. Well, just calm down. If you'll notice, women in general have heart disease because women are said to be extremely excitable. So those are the kinds of things that sometimes it goes unnoticed.
Right.
What we really feel and what we say.
And I feel like that language, because it's so prevalent, women are excitable, women are dramatic, that leads to you not hearing me when I'm speaking and I'm saying something is wrong with me. Because you feel like, oh, she's just being dramatic.
Absolutely. And that's why often I'll say to just calm down. Just tell me what you're saying or thinking in my life coaching side of me. But, you know, just, and
That's fine, that's fine. When COVID struck, which we are still dealing with that, and we're still dealing with the effects of that, Black people were not getting the vaccine. Why do you think that was?
I think because of what we talked about, really. First of all, the thought that it's going to give me COVID. It wasn't a live vaccine.
Correct.
So that, I mean, even if it was, they had worked through that. But it wasn't a live vaccine. So it wasn't going to give you COVID. But people believed that that's what it was going to do. Not just, I mean, people in general. We heard that quite a bit. You know, not just African American people believe that. People in general said, I think it might give me COVID. Well, you know, a lot of times what we react to, it's because of what we have perceived that has happened in the past. You know, people still think the flu vaccine gives them the flu. And there are people that I know who say, oh, I don't take the flu vaccine because I think it's not a live virus. It's not a live vaccine. So that's not the case. It's, but, you know, sometimes, depending on how your system reacts to things, you may get symptoms of the flu.
Right.
When you get the flu vaccine.
Right. And, you know, with the flu vaccine and with COVID, it's the mistrust. And we've just talked about like 2 or 3 things that's happened to Black people in the United States that has continuously fed into that mistrust between the Black community and healthcare.
Right.
So during COVID, President Biden put out, and I'm sure you saw this, he put out a mass campaign targeting specifically Black people to encourage them to get the COVID vaccine. Do you feel like campaigns like that are beneficial in helping Black people to understand and ultimately decide to go and get the vaccine or to trust healthcare?
I think the delivery of that kind of information can be impactful. Who delivers it? You know, first of all, it can't be someone you don't have an idea of who they are. You know, if an athlete says it, you know, some kids are adults
too
may say, oh, well, if he did it, then I'm comfortable doing it. So, yeah, I think those campaigns can be helpful. As a matter of fact, I read an article in the New York Times, and there was a study that had been done that said that it did impact it, and there were more people after those campaigns who did go and get the COVID vaccine.
I feel like President Biden did an excellent job with that campaign because he realized, or someone in his cabinet realized, that mistrust between the Black community and healthcare is still here. We need to do something about it. And we need to be intentional about doing something about it. So I thought that the rollout of the campaign was really, really good, which now that you're saying it, I can see why more Black people went and got that vaccine after that campaign rolled out, because they were so intentional with it.
Right.
Yeah, I thought he did a great
Intentional
job.
campaigns make a difference in healthcare.
Yes, absolutely.
Well, in anything, but
Absolutely. So in your 30 years of working in the healthcare field, really it's been more than that, as we have established. It's been more than that. What needs to be done to repair the trust or the mistrust between the Black community and healthcare? What do you think needs to be done?
I think that process has started.
Okay.
I think that the healthcare community in general doesn't see a difference. I think we do need to continue to educate both the physicians and the community about having open and honest conversations. I think we need to see that the medical community certainly listens to what we say. I may have a pain in my back. This is where it is. This is where it hurts. Test, do something. But I also think we need to look at insurance, and specifically in Texas, what we do to take care of that vulnerable population that doesn't have insurance. And so, not that they get second-rate care, but there's just a different level of care because they don't have access to the health care that they need.
Do you think that Black people have any kind of ownership in the mistrust between their community and healthcare?
I don't think they have ownership in the mistrust. What I think they do have, though, is a lack sometimes of understanding. And it's just not Black people, but it's just not understanding the truth about it. Like we talked about the Tuskegee study. People didn't know that. They thought they were given syphilis. Was the whole study wrong? Yes. But the facts around the study really kind of make a little bit of difference. They still didn't do the right thing.
Correct.
But they didn't give people the disease. People already had the disease.
Do you think that Black people should do anything to help repair that trust?
I think, again, open and honest conversations with healthcare providers, accessing healthcare when they need initially. You know, sometimes we wait. That's just a pain. Oh, it'll be okay. You know, often, and the truth is, many times we're afraid to know.
Right. That's why we don't ask the question, because we don't want the
We
answer.
don't want to know. We don't want to know. And so, because what we believe, and this is again what we've seen, and I use cancer because I'm working with the gift of life now, but people are late to come in to get tested because it'll go away. It'll go away.
And it doesn't.
No, it's not going to go away. It can be treated. You know, it can be in the beginning stages of the cancer, but it's not going to go away. And home remedies don't treat it. You have to go to a physician and be tested for whatever it is. And we just ignore signs and symptoms. And that's, and I say we, people in general. But specifically, if we've not been accustomed to going to the doctor, you know, we ignore those things.
Right. Do you think in 2024 that Black people should just get over it? Because the Henrietta Lacks, that was in 1951. Not that any of these times were a long time ago, but Henrietta Lacks, that happened in 1951. The Tuskegee Experiment ended in 1972. Of course, there are countless other examples that we can give. But do you think that in today's day and time, let's just get over it and move on?
I can't say I think we need to get over anything. I think those things happened. I think we need to figure out what it was that really happened and work through it and make sure that things change, but we can't just get over it.
As if it never happened.
As if it never happened.
When I was preparing for this interview, and this was a shock to me, it stated that in the Black community, I'm specifically talking about, people as young as 18 years old do not trust health care. I thought that the statistics was going to show older people. But 18? Why do you think it's so young that they already have this mistrust?
And, you know, I wonder, I have not read that study, but I wonder if that's just a mistrust of the system.
Okay.
Not just a mistrust. I mean, healthcare is a part of the system. So do they just not trust the system?
That's a good question. And they're just kind of lumping
They're
in.
just putting everything together.
Yes.
You know, and they've heard about, you know, they've read about Tuskegee. And so they take that and they pair it with other things. Now, I don't have the answer to the question, but I think that's a thought about what it could be. Are people just pairing things? Kids hearing from grandmother, great-grandmother actually, if they're 18, what was the Tuskegee situation. And great-grandmother heard it in school, so I think that, you know, so are we just... And then we don't take time. We can Google anything, but
we can.
But a lot of
But
times
do
we
we?
don't do that.
Exactly. But do we? Do we? So you being a Black woman in the healthcare field, do you feel like just your presence, and of course you have a lot of knowledge and a lot of wisdom in the field as well, but do you feel like just your presence helps to build trust in the community?
I would hope so. I would hope that I have spent quite a bit of my life in healthcare. And so I don't know everything, but I do know things about health and about people and about being an African American, certainly.
Yes.
So hopefully it does, you know. And that's why I always want to keep a presence, because I want our community to be recognized for who we are, what we do, and I want every Black woman to understand how important it is to take care of themselves.
Absolutely.
You know, and not necessarily put themselves first, second to God.
Very well said. What is your intention in the healthcare field?
My intent, for as long as I can, is to help to educate people in general about healthcare and the importance of wellness, about the whole body, not just about a specific component. I teach a class called Active Living After Cancer, and it's designed for people who have had cancer and gone through cancer. But the classes are so significant. I, thank God, am not a cancer survivor. I've never had cancer. But I have learned, even from teaching the class, because we talk about stress management, we talk about nutrition, we talk about setting goals. And those are all things that we all need to know.
Yes.
That's not just about what happens after cancer. Why don't we teach that before cancer? And how it applies to if I have hypertension, or how it applies to if I have diabetes. You know, those are all things that are important. If there's something that I wish we could do about healthcare, we'd start to teach kids at a younger age in every environment about what's important to eat. And we do, but do we follow through with that?
Right.
You know, and people are living longer.
They are.
People are living longer. So
In 2012, you retired
I did.
as the director of the public health department in Beaumont, Texas. One of the things you said you wanted to do upon retirement was go to San Diego, California. Did you go?
I did. My husband and I actually had that trip planned. We went for business and pleasure. I went for pleasure and went to every winery, and he went for business. So yes, we did go. We spent about a week and a half.
Good,
Yeah,
good.
we did go.
Now, as we were talking off camera, you went back to work.
I did.
You retired, then went back to work, and now you are working for the Julie Rogers program that's located in Beaumont, Texas. So tell us what your job description is and what is your title.
I am the strategic healthcare manager. I work part-time.
Okay.
And my job is to do everything. It's amazing when you work for a nonprofit.
Yes.
You take on different roles. So I may teach a class. I may be helping to write a grant. I may be working on a champagne and ribs event.
Yes.
So I'm just enjoying, and I may be calling clients. You know, we do a prostate cancer screening program. So sometimes I work with our men to move them through the process of getting care, because in Texas we don't have that. We don't. For men, if a woman is diagnosed with breast cancer and she's does not have insurance, then there is a program that she can qualify for. For men, there is not such a program. So we work with different physicians in our community to get men through the process. If we diagnose you, we want to make sure that you're taken care of.
Do you follow them, or does the program rather follow them to the end of like treatment and
We follow
surgery?
them to surgery.
Okay.
We ensure that if surgery is necessary, it may be chemotherapy, it may be radiation, it may be just a watchful waiting situation, because prostate cancer is a slow-growing cancer, often depending on when it's staged and all of that. So it may be that there's nothing done and they're given something, just to...
When you retired in 2012 and decided to go back into work part-time, obviously, why did you choose to go back into healthcare? I feel like you could have chose anything.
That's what I know. That's what I'm very comfortable with. That's what I can sit and have a conversation with you about.
Yes.
For hours and not pick up the computer and not Google and not do any of that, because I'm comfortable with that, and I believe in it. I believe that people deserve quality health care, and I believe that they have some ownership in that. And I want to always share that with people, with anybody who listens.
Good. What I know you Julie Rogers program offers prostate services. What other services do you guys offer?
We offer free mammograms.
Okay.
To medically underserved individuals in our community, in 7-county service area. We offer, during June and July, we offer free prostate cancer screening for men, and it is not an invasive procedure. It is a blood test. Okay. So I want every man to know that.
I was going to ask you that.
It is simply a blood test. I also, at those particular clinics, we offer preventive health screenings. We do blood pressure screening. We do screening for cholesterol. We do screening for diabetes. And so if those tests, particular tests, we refer them to their private doctors or to one of the federally qualified clinics in our area. And so we encourage them to get that done and to take care of that if they have any screening, because it is just a screening. So a one-time high blood pressure does not diagnose hypertension. You have to have several readings, and the same thing with diabetes.
So whenever people come in for the screenings, of course they have to sign and give permission.
Oh, absolutely.
Yes.
Absolutely.
Have to sign and give permission. Do you, and I'm not sure what your process is, so I need you to expound on this. Do you do the testing right then? Do you have a lab? How do you determine if they have prostate cancer or high cholesterol?
We work with a couple of labs in our area.
Okay.
And so, of course, there's a permission slip for us, for them to do the test. And so we send, at the expense of the Gift of Life, we send them to the lab, and they determine their PSA, which is a prostate antigen, to determine the level. In the, specifically prostate specific antigen PSA, and to determine their levels. And then if they have elevated levels, those are reviewed by our medical director, and then they are sent to a local urologist or to their private doctor if they have one.
Okay.
And then they do other testing, further testing, to determine what the situation is, because they could have an elevated PSA for other reasons. And that's why, young men don't need to have a PSA unless they're having a problem, because it may be elevated for other reasons.
Okay. So when you say young men,
Men under the age of 40.
perfect.
Unless they have a history of prostate cancer
In the family.
in the family, and that could go as low as 35.
Once the information is sent off to the lab, then do they receive a letter in the mail, a phone call? What is the next step?
They will receive a letter in the mail. We will do some more in-depth financial screening to determine their eligibility for our program. If they're not eligible for our program, we move them to try and encourage them to go and get insurance, and to go to, and the only reason they wouldn't be eligible is because they do have insurance. And so we ask them to use their insurance, because other than that, we pay for their care. And that's through the generous donations of the wonderful people in our community, and also the grants that we get. So, and the care can be costly for someone who has prostate cancer.
When you say care, what specifically are you referring to?
I'm referring to their, we work with them to get their chemotherapy, radiation. We pay for their biopsy if they meet the qualifications of our program.
Really?
Yes.
Wow, I never knew that. I knew that Julie Rogers program paid for like some things, but I didn't think it was for
Only
the
those
care.
things related to
Yeah.
to prostate cancer, and that's because with breast cancer we pay for the biopsy for women too. We pay for the screening mammogram if there's a problem and they need an ultrasound. We pay for that. We pay for the biopsy. Yes, we do.
I want to just bring this up really quick so you can educate my audience on this. It is possible for men to get breast cancer, correct?
Absolutely, absolutely. There are men who have breast cancer. Now, the Gift of Life does not test or do pay for mammograms or anything for men with breast cancer. But yes, men do get breast cancer, and we've had people where we've gone to programs where men spoke about their breast cancer, but we do not screen for breast cancer in men.
Why is it so important? I know it's important for all men. I'm not excluding anyone. But why is it particularly important for black men to be screened for prostate cancer?
Well, black men have a higher rate of prostate cancer. They have a family history, often, of prostate cancer. And also, they have sometimes a late diagnosis because they don't go to the doctor. Men in general, that's why we do the screenings for them, because men in general don't want to go to the doctor. I'm fine. I'll be okay. And so they don't go and they don't get things checked out. And so a lot of times they have a latent diagnosis. And a latent diagnosis means not as good an outcome.
Right. Is there a cure for prostate cancer?
Yes, absolutely. Absolutely. You can go in. I mean, we have men in our support group who were diagnosed 20, 30 years ago. There is a cure. It can be treated.
Now, you also offer hypertension screenings. Explain to us what that is.
We do hypertension screenings at our men's program. And hypertension is something, again, that plagues the black community. And it may be because of diet. It may be because of the stressors, a number of things. Maybe family history as well. But hypertension is when the blood comes from the heart to the body
Mm-hmm.
and the push of the blood and the intensity of the push. Sometimes we may have blockages or may have something that's causing us, and so the pressure to do that, to push it through, is just high.
Oh, and how do you screen for hypertension?
We do the cuff
Okay.
and listen to the heartbeat and the heart rate.
If people wanted to get more information on the Julie Rogers program, they wanted to donate, or maybe they wanted to come to one of the screenings, how could they get in touch and find that information?
They can call the Gift of Life office. The number is 409-833-3663 and get all the answers and questions that they may have. They can come to some of our events. If they're a survivor, and even though they didn't come through our program, we have survivors that we do survivor celebrations for, and we would love to have them to be a part of that. And a lot of times, I mean, they're fun.
Mm-hmm.
We did a survivor drive-through program at Philpott Ford,
Okay.
and we had about over 200
And that's in
people.
Beaumont, Texas.
It's in Mid-County.
Oh, Mid-County. Okay.
And we had about 200 people who came through, and they got their lunch, and we gave them information about the Active Living After Cancer program, which is a program we really want people to participate in. If you've had cancer, it doesn't matter how long ago. This just helps them to get back on track. My last class that I taught, there was a woman in the class. She'd been diagnosed, I want to say 8-9 years ago, and she shared with us how this class had made such a difference, because we encourage people to get physically fit and to walk, nothing strenuous, but just get your 10,000 steps a day in,
Mm-hmm.
Just to walk. And she said we had made such a difference, she's going to take the class again. What better feeling can a facilitator have as to know that you have encouraged someone who didn't walk at all, who thought, oh yeah, well, I don't count those steps.
Yeah.
You're in the kitchen, count the steps.
Yeah.
Every movement helps. But
Yes.
honestly, I mean, it was just a great thing. So the class is just amazing.
Mm-hmm.
It really is. And it's an MD Anderson curriculum.
Okay, wonderful.
So it's something that we're working with MD Anderson on.
As we get ready to wrap up this interview, I have 2 more questions for you, Ms. Holmes. The first one is, what piece of advice would you give to my audience as it pertains to healthcare, the importance of healthcare?
I think the most important thing about healthcare is know your body. Know the changes in your body. If you have a mole that wasn't there and you see it changing, know that. If you've lost weight and you're not trying, recognize that. If you're having hair loss and you don't know what's going, it could be a nutritional issue. Go to the doctor and have it checked out. Don't ignore the signs and symptoms of your body. What works for me might not work for Crystal. So don't go and say, well, Crystal, this is happening to me. What do you think? And Crystal shares with you, well, was Crystal. Know that that's not typical for you. So the most important thing is to know your body. As best you can, eat nutritiously. We're on Facebook and we watch all these wonderful recipes.
Yes, we do.
And they look so good.
Yes, they do.
And sometimes those same recipes can be kind of tweaked. Like, I love collard greens, but I can cook them with smoked turkey as opposed to other kinds of meat. Not that I always do. And remember, everything in moderation.
Yes.
Everything in moderation. There is nothing wrong with having a glass of wine. There is a problem having 1 or 2 or 3 or 4 or 5 every day.
Yeah. Yes.
So kind of know your body.
Yes.
Know your environment.
And my very last question for you is, who do you think would make a great guest on the podcast, but you have to help me get them on?
But I think Celia Scott
Okay.
would be an amazing person to talk about financial health. And she does a great program on financial health.
know what? I love how you phrase that, financial health. I've never heard it phrased that way. You hear financial literacy, financial
no,
classes.
No, I had financial planning on there, and I kind of changed it.
But really, your financials determine health.
Yes.
It really does. I cannot wait to
And
speak
your
to her.
health determines financials.
Look at you. Yes, it does. Yes, it does. You have been amazing.
Thank you.
Thank you so much for joining me on this podcast.
Thank you for having me.
Yes. And we both wore black. This was not planned.
It was not at all.
It was not planned. I walked in and she had on her black. I was like, yes. Yes. But thank you so much for agreeing to sit down on this podcast with me. I appreciate you.
Thank you. Thank you so much.
And thank you for tuning in and watching. You can get this podcast and all of my other podcasts on YouTube Podcasts and Apple Podcasts. And remember, you always have time to listen and learn on the go.
Come on, let's go on a journey. Sit back, buckle up, enjoy the ride with Crystal Petry Consultation.